it's more of a comment, but I think it's kind of come out of this, and I just wonder whether, so it's increasingly striking me in a slightly strange way that time seems to be quite important ethically. So thinking about authorship, you know, the number of times I've been involved in a conversation with scientists near the end of a project, they've written a paper, small group of them, a writing group, your mention of writing groups. They've written a paper and then they say, okay, who should be an author on this paper? And then they have all these struggles about, well, how do we organize that? How do we list people? How do we decide who should be on? And it just strikes me that's a bit odd in a way. In a way, what should be happening is when people are thinking about writing a paper, they should say something like, who should be involved in writing this paper? And if there's a reason for, there's a slight difference between science and ethics. So in ethics writing, mostly we think of writing the paper as doing the research, more or less. You know, we're kind of thinking as we write. In science, I know that often a paper is a report of research that was done, so it's slightly different. So it needn't necessarily be the case that someone has to have written a word to be an author, so I can see that. But it does strike me often that timing, when that question is asked, is quite important ethically. You know, and it often the question about who should be an author or who should be a collaborator is often asked quite late, and maybe we should be asking that earlier. And maybe that's a general point, but it's a sort of theme really that came out.
And similarly, I think Sunil's example was about expanding that argument or expanding the thought. The discussion about what data is available when needs to probably be had before the data is actually there. Yeah. Joe, do you have any comments? Okay. Joe.
This might be just a comment also, but maybe the panel could speak to this. I was really struck, particularly by the last presentation, but also some comments people have made previously, by how much the challenge with data sharing turns out to be a lack of use of shared data. That is, very few requests for the data that's available. Whereas I came into this meeting with the impression that the problem from the perspective of ethics was the data gets made available and then well-resourced high-income country institutions jump on it, do the analyses, publish the paper, and don't give credit where we'd want it to be given. But it sounds like there's a sort of bigger problem, more basic problem, which is there's just not enough people, whether from high-income countries or lower middle-income countries, who are requesting the data that's available and doing analyses at all. So could you speak to that, whether that's a more basic problem that we have than the high-income countries, stealing, as it were, all the opportunities to do interesting analyses?
So I think that it's evolutionary in a way. And data sharing has developed some momentum and it's mandated, so that's starting to happen. I think that anyone who's tackled secondary use of data will realize that it's not the easy, quick win that people would imagine. There's massive amount of effort in terms of data curation, going back to data contributors, clarifying, and you get such heterogeneous data that getting clear, simple answers takes massive data sets. So it's way, way harder. It quite often takes years. And so for a lot of people, they've been involved in one study group and they think, well, I'm really glad I did that and I know I'll never do it again because your hair falls out, you get gray. So I think that it's one of these things that as data sharing has built up some momentum, not enough yet, but I think is doing quite well. I think that it will be one of the things that will sort of have a lag time and then take off. Because once we've curated the data, then the next time we use it, it's quicker and easier. People understand the process. They know what they need to respond to quickly, how to make it work. So we've now got some of the worn data sets have been included in 4 or 5 study groups. And in that way, I think we will build momentum over time. But I think that what we need to work out ways to make it easier and more efficient to do those individual patient data analyses in the same way that we spent a lot of time first building the ability for people to willingly share data. But I agree with you totally.
Julio,
And even
Sunil?
among high-income countries, the use is pretty low in our experience. So there's not that much.
Yeah, I think that there is also this argument of efficiency. So I'd rather want to have a data repository and make sure that if someone needed to analyze the data is already there. So that's the issue that we have with Ebola, with epidemics, that you cannot return to get the data. So I think that still, even though we need to work onto this issue to make people more aware that this data is there. I mean, this is one of the issues that needs to be in place, need to be discussed in ethics committee, that they need to be aware that this data, we can improve science by having data repository. We cannot come back 2 or 3 times to the same community to make the same trial. So it's really good to have a data repository, but it's not enough. And I agree with you. We need also to make sure that people are aware of the data and they will come. We might not be able to work in that second phase, what I meant. Probably others should be aware, like funders, that they could promote more secondary analysis of data, for example.
Great. So we have time for one more question and lots of hands. So keep your thoughts for the next session. Who has the most burning question that can actually that can be directed to the whole panel, not just to the Warren case study? You're very convincing, and that hands has been up for a while. Apologies to all the others in the room. Good.
It is a slightly different aspect, which is why I wanted to ask the panel together, not the secondary use issues which we have been discussing. And it comes from something which comes out of the discussions about data sharing during outbreaks and emergencies, but I think has potentially application to other sorts of studies and trials. And this relates to preliminary data sharing before the study is completed, certainly before the final analysis is completed. And when the investigators discover something, and this relates a little bit to your description of what happened in your corticosteroid trial, when the investigators discover something which is appears to them to have some potential either cause for concern or positive potential of an important change in practice. And how do we bring not data sharing to the open world, but concepts of planned data sharing, at least as part of a discussion with the relevant groups or authorities, whether it's you shared with WHO, it might be public health authorities. How do we bring that concept in so that researchers are comfortable? And might that also relate to the concept of study groups, for example, where people may need some help at that point in understanding whether their concerns are accurate, whether there are certain either analytic or other steps that need to be done by providing a more sophisticated analysis if necessary. And it's this concept that Karen brought up about impatience and growing impatience. I'm concerned about fairness to the researchers, but I'm also concerned that this work is done for benefit which is manifest as rapidly as appropriate. So I just wondered what people think about how to deal with the issue of preliminary data sharing. And yeah, there's a few other. But obviously there are issues of quality assurance and so on there.
Great. So we have a couple of minutes left. So if I can ask you to be a little bit brief in your response.
Yeah, I think the concept of data sharing is improving nowadays. But in cases like ours, where it was unique, there was a real interest from other people. But I think there should be some relaxations or some regulation modifications in the regulations if we need to use it like preliminary before all the analysis is completed.
Can I answer?
No comment. No comment.
And
either.
Tina?
Such a great. Is that a response?
Yes.
Good.
may I?
Excellent. Okay. And
So,
then that's
hi, I'm from the MIDA Oxford Research Unit. We've had that request from some groups, and we have shared data pre-publication. So it's so we asked for a collaboration, and we asked them to, well, you can have the data, but please don't publish before we do. But the data was released before before we published to the group. So in the contract, it's quite clear that you can start working on the data, you can prepare your manuscript, but just wait until the primary research is published. That's what we've done.
great. So thank you. Thanks to the panel members for 3 excellent talks, and thanks to the audience for bearing with us and for having some excellent questions.